Accurate diagnosis is the foundation for effective treatment, but challenges in medical diagnosis remain. This presentation will explore a multifaceted approach to improving diagnostic accuracy and patient outcomes. We'll cover key strategies and best practices across various aspects of the diagnostic process. The goal is to equip clinicians with tools and techniques to enhance their diagnostic capabilities and deliver better care for patients. The human body is an incredibly complex system with many interconnected parts, making the process of diagnosis quite challenging. Symptoms often overlap between different diseases, making it difficult to definitively identify the underlying cause. This uncertainty adds significant complexity to the diagnostic process. As a result, healthcare providers must navigate this complexity and uncertainty carefully in order to arrive at an accurate diagnosis. Understanding the inherent challenges in diagnosing health issues is an important first step in improving the diagnostic process. Diagnostic errors can have serious consequences for patients, leading to delayed or inappropriate treatment, worsening of their condition, and preventable complications. Misdiagnosis often results in increased morbidity, with patients experiencing prolonged illness and suffering due to the failure to properly identify their underlying health issue. The financial impact of diagnostic errors is also significant, as unnecessary tests and procedures required to correct the initial misdiagnosis contribute to higher overall healthcare costs. It's crucial that we work to improve diagnostic accuracy and reduce the incidence of these types of errors in order to provide the best possible care for our patients and ensure the efficient use of healthcare resources. The high cost of misdiagnosis is a significant issue in the U.S. healthcare system, with an estimated annual cost of $19.1 billion. Misdiagnosis contributes to 5 to 10% of preventable hospital readmissions, which adds further strain to the healthcare system. Unnecessary tests and procedures due to misdiagnosis can increase healthcare expenses by 15 to 30%, further driving up costs. Addressing the problem of misdiagnosis is crucial to improving patient outcomes and reducing the financial burden on the healthcare system. The emotional impact of misdiagnosis can be profound for patients and their families. Prolonged uncertainty and anxiety are common, as patients struggle with a cycle of worry and distress. Patients may lose trust in their healthcare providers, leading them to be hesitant about seeking further care. Misdiagnosis can cause significant emotional distress, not just for the patient, but for their loved ones as well. It's important to acknowledge and address these emotional challenges as part of the overall care and support for patients and families. Diagnostic errors can have serious consequences for patient outcomes, so it's critical we understand the root causes. Cognitive biases like anchoring, confirmation, and availability bias can lead clinicians to misinterpret symptoms and test results. Incomplete or fragmented patient data, such as missing medical history or lab results, can hinder accurate diagnosis. Traditional diagnostic tools have limitations, but emerging technologies like AI and genomics offer potential to overcome these, though adoption may be challenging. This slide introduces the topic of cognitive biases in clinical decision-making, which can lead to errors and suboptimal patient outcomes. Anchoring bias is when clinicians overemphasize initial impressions or diagnoses, failing to consider new information that contradicts their initial assessment. Confirmation bias is the tendency to selectively seek information that confirms their initial hypothesis, ignoring evidence that contradicts it. Availability bias is when clinicians overestimate the likelihood of diagnoses that are readily available in their memory, even if these diagnoses are less likely based on the actual evidence. Understanding these cognitive biases is important so clinicians can be more aware of them and take steps to mitigate their influence on decision-making. Lack of access to comprehensive patient data is a major challenge in healthcare. Patients often have medical records, lab tests, imaging scans, and medication histories spread across different providers and systems. This fragmentation makes it difficult for doctors to get a complete picture of a patient's health history. Having access to this information is crucial for accurate diagnosis, effective treatment, and preventing dangerous drug interactions. Integrating these disparate data sources into a centralized, comprehensive patient record would greatly improve the quality of care. This would allow doctors to make more informed decisions and provide better, more personalized treatment for their patients. Traditional diagnostic tests may not be sensitive enough to detect diseases in their early stages when treatment is most effective. False positive results from these tests can lead to unnecessary treatments and cause significant anxiety for patients. The interpretation of diagnostic data can be subjective, with clinicians' experience and biases influencing how they interpret the results. Traditional tools often provide a narrow view of a patient's health, failing to capture the complexity of individual biological and lifestyle factors that can impact their condition. Emerging technologies like AI, NLP, predictive analytics, genomics, and wearable devices are revolutionizing medical diagnosis. AI-powered algorithms can analyze large datasets to identify patterns and predict disease risk. NLP tools can analyze patient narratives and medical records to provide valuable insights. Predictive models can anticipate future health events, enabling early intervention. Genomic sequencing reveals individual genetic predispositions, allowing for personalized treatment. Wearable devices continuously collect vital signs, enabling remote patient monitoring and earlier detection of health issues. Artificial intelligence, AI, and machine learning, ML, are powerful tools that can transform healthcare. These technologies excel at identifying complex patterns in large datasets, which can reveal important insights. For example, AI or ML algorithms can detect disease trends, predict patient outcomes, and assist with diagnosis. Additionally, AI models can make accurate predictions about disease risk, treatment success, and potential complications. This predictive capability allows clinicians to make more proactive, personalized decisions in caring for patients. By leveraging the pattern recognition and predictive power of AI or ML, we can enhance clinical decision-making and improve patient outcomes. Natural language processing, NLP, is a powerful tool for analyzing textual data in the medical domain. We can use NLP to extract key information from sources like medical records, patient narratives, and online health forums. This extracted data includes symptoms, diagnoses, and treatment details that can provide valuable insights. NLP also allows us to identify patterns in patient language, such as symptom clusters or recurring themes. These patterns can assist clinicians in making more accurate diagnoses and assessing patient risk. By leveraging the power of NLP, we can gain a deeper understanding of the patient experience and improve healthcare outcomes. Predictive analytics can help identify patients at high risk of developing diseases early on. We collect comprehensive patient data, including medical history, demographics, lifestyle factors, and genomic information. This data is used to develop advanced predictive models using machine learning algorithms. These models are trained on large datasets to identify patterns and predict disease risk for individual patients. By assessing a patient's risk profile, we can implement preventative measures, early screenings, or lifestyle modifications. We continuously monitor the effectiveness of these interventions and refine the predictive models as we gather new data and outcomes. Genomics is revolutionizing healthcare by enabling personalized medicine. Genetic testing can identify individual genetic variations, which helps predict disease risk and guide treatment choices. Pharmacogenomics uses genetic information to tailor drug prescriptions, optimizing effectiveness and minimizing adverse reactions. Personalized treatment plans leverage an individual's unique genetic makeup to enhance therapeutic outcomes and patient well-being. These advancements in genomics and personalized medicine are transforming how we approach healthcare and improve patient outcomes. Wearable devices continuously monitor a patient's vital signs, providing real-time insights into their health. The collected data is transmitted wirelessly to healthcare providers, enabling remote monitoring and early intervention. Wearable data empowers patients to track their own health, make informed decisions, and engage in self-management. Remote monitoring can detect subtle changes in health indicators, facilitating early diagnosis and treatment of diseases. Proactive monitoring and early intervention improve patient outcomes, reducing complications and hospitalizations. This slide introduces our vision for enhancing clinical decision support systems. We'll discuss how integrating diverse data sources can provide a more comprehensive view of the patient. I'll explain how sophisticated AI algorithms can be used for pattern recognition and risk assessment. I'll highlight how the system can deliver personalized recommendations tailored to individual patient characteristics and risks. Finally, I'll emphasize the importance of designing intuitive user interfaces for seamless integration into clinical workflows. Communication is key in healthcare as it helps build trust between providers and patients. At the individual level, encouraging active listening and clear explanations from providers can go a long way in fostering that trust. Effective communication among the healthcare team is also essential. Team-based care requires seamless information flow. At the systems level, implementing communication tools and protocols helps ensure smooth information exchange and coordination. Overall, improving communication at all levels, individual, team, and systems, is crucial for delivering high-quality, patient-centered care. Patients need to be well-informed about their health conditions and diagnostic options in order to make informed decisions. Providing clear, patient-friendly communication and resources can help empower patients to better understand their diagnoses. Interactive tools can further engage patients and help them grasp complex medical information, encouraging patients to ask questions, express their concerns, and actively participate in the diagnostic process builds trust and collaboration. Shared decision-making allows patients to take ownership of their health and feel more confident in their treatment choices. Efficient patient intake is key to gathering comprehensive data and understanding the patient's medical history, symptoms, and vital signs. Careful selection of diagnostic tests based on the patient's presentation helps minimize unnecessary procedures and delays. Leveraging decision support systems enables rapid and accurate interpretation of test results, supporting timely diagnosis. Clear communication of diagnoses and treatment plans is essential for engaging patients and ensuring they understand next steps. Seamless transitions between care settings and prompt initiation of appropriate treatment are critical for positive patient outcomes. Standardized diagnostic protocols are crucial for ensuring consistency in healthcare delivery. These protocols are based on the latest evidence and best practices, leading to more accurate and reliable diagnoses. Implementing standardized protocols helps streamline the diagnostic workflow, reducing delays and improving overall efficiency. This allows healthcare professionals to focus on providing high-quality, patient-centered care. Consistency, evidence-based guidelines, and efficient workflow, these are the key benefits of standardized diagnostic protocols. A diverse team with different specialties can bring a broader range of knowledge and perspectives to a project. This allows us to consider a wider range of possibilities and solutions that may not be obvious from a single discipline. Collaboration between experts helps us identify and interpret more subtle signs or details that could be easily missed by one person. By cross-referencing our different areas of expertise, we can conduct more comprehensive assessments and arrive at more accurate diagnoses or conclusions. The key is leveraging the complementary skills and insights of a multidisciplinary group. Regular data analysis helps us identify trends and areas that need improvement in our diagnostic processes. Establishing feedback mechanisms allows clinicians and patients to report errors and near misses, giving us valuable insights. Conducting thorough root cause analyses helps us understand the underlying causes of diagnostic errors so we can address them effectively. Implementing process improvements based on our findings can help enhance workflows, protocols, and training to improve diagnostic accuracy. Continuously monitoring the impact of these changes is crucial to ensure we sustain improvements over time. Diagnostic errors are a critical issue in healthcare that can have serious consequences for patients. We need to create a culture where clinicians and patients feel empowered to report errors and near misses without fear of blame. By investigating the root causes of these errors, we can uncover systemic problems in our processes and protocols. Using this feedback, we can then implement targeted improvements to training, technology, and workflows. Continuous monitoring is key to track the impact of these changes and ensure we're driving sustained improvements in diagnostic accuracy over time. This multifaceted approach of error reporting, root cause analysis, process improvement, and ongoing monitoring is critical to addressing this challenge. Fostering a culture of diagnostic excellence is crucial for improving patient outcomes and reducing diagnostic errors. Open communication between healthcare providers and patients is key. It builds trust and helps identify potential issues. Encouraging a collaborative learning environment where professionals share knowledge and review cases together leads to continuous improvement. Empowering patients to actively participate in their care is also important. Educating them on their role in the diagnostic process promotes shared responsibility. By focusing on these three pillars, open communication, collaborative learning, and empowered patients, we can create a culture that prioritizes diagnostic excellence. Patients have valuable insights into their own health that can help providers make more accurate diagnoses. When patients feel involved in their care, they are more likely to follow treatment plans, leading to better outcomes and reduced costs. Engaging patients as active partners in their health care is key to improving accuracy and adherence. By empowering patients, we can create a more collaborative and effective healthcare system. Patients play a crucial role in the diagnostic process, and we want to empower them to be active participants. One key way they can contribute is by tracking their symptoms, recording when they occur, how severe they are, and any patterns they notice. This provides valuable insights for the medical team. It's also important for patients to be familiar with their family and personal medical history. This background information can help guide the diagnosis. We encourage patients to ask questions throughout the process. This helps clarify any misunderstandings and ensures they are fully informed and engaged. Ultimately, we want patients to be partners in the decision-making process. They should understand the available treatment options and work together with the medical team to determine the best course of action. Health literacy and cultural factors can create significant barriers to patient understanding and engagement with their care. Patients with low health literacy may struggle to comprehend medical diagnoses, treatment plans, and self-care instructions. Cultural beliefs, values, and language differences can also influence how patients access and interact with the healthcare system. To provide culturally competent care, we need to offer language interpretation services and communicate in a way that is sensitive to patients' cultural backgrounds. Patient education materials should be developed using plain language, visual aids, and formats that are accessible and easy to understand. These strategies can help ensure all patients, regardless of their health literacy or cultural background, can actively participate in managing their health. Expanding access to diagnostic resources is a critical priority to ensure equitable health care for all. We're focusing on two key strategies to achieve this: infrastructure development, investing in building new diagnostic facilities, especially in underserved areas. This expands access to advanced equipment and skilled professionals. Telemedicine and remote diagnosis, leveraging technology to connect patients in remote areas to specialists and diagnostic services. This reduces travel time and expenses, making diagnosis more accessible. These complementary approaches will be essential to bringing high-quality diagnostic capabilities to communities that have historically lacked them. Telemedicine is expanding access to healthcare, especially for patients in remote or underserved areas. By eliminating the need for travel, telemedicine reduces costs and time commitments for patients. Patients can now conveniently consult with healthcare providers from the comfort of their own homes. This improved convenience leads to higher patient satisfaction and better adherence to care plans. Overall, telemedicine is making quality healthcare more accessible and convenient for patients. Point-of-care testing allows healthcare providers to rapidly assess a patient's condition and make quick decisions about treatment. These tests can check for things like blood sugar levels, pregnancy, infections, and urinary tract issues. They provide immediate results, which is critical for managing conditions and making timely interventions. Point-of-care testing improves efficiency and quality of care by enabling faster diagnosis and treatment. These tests are convenient, easy to use, and can be performed right in the doctor's office or clinic. They empower patients to take a more active role in monitoring their own health. Community health workers are trusted members of the communities they serve, allowing them to act as bridges to healthcare access. They can provide culturally appropriate outreach, education, and support to address health disparities in underserved areas. Their local knowledge and rapport with the community enables them to collect accurate patient data and facilitate timely referrals. This helps contribute to more accurate diagnoses as they understand the unique needs and context of the populations they work with. Disparities in diagnostic access are a significant challenge. with socioeconomic, geographic, and cultural barriers contributing to the problem. Limited financial resources and lack of health insurance make it difficult for many to afford essential diagnostic tests and services. Residents in rural and underserved areas often face long distances to access specialists and advanced diagnostic facilities, creating significant barriers. Language differences, cultural beliefs, and mistrust in the healthcare system can prevent effective communication and access to appropriate diagnostic services. Providing culturally competent care and language interpretation is crucial to addressing these disparities and ensuring all patients receive the care they need. The key challenges we face in improving diagnostic accuracy for underserved populations are socioeconomic, geographic, and cultural/language barriers. Financial limitations often prevent access to necessary diagnostic tests and specialist care, with lack of insurance and high out-of-pocket costs exacerbating these disparities. Distance, transportation difficulties, and limited access to healthcare facilities pose significant obstacles, leading to delayed diagnosis and potentially worse health outcomes. Language differences, cultural beliefs, and mistrust in the healthcare system can hinder effective communication and diagnosis. Culturally competent services and language interpretation are essential for building trust and understanding. Addressing these multifaceted barriers is crucial to ensuring equitable access to accurate and timely diagnosis for all members of our community. Social determinants of health are the conditions in which people are born, grow, live, work, and age that shape their overall health and well-being. Socioeconomic factors like income, education, and employment can affect access to healthcare and preventive services. Poverty and lack of insurance can hinder people's ability to get diagnosed and treated. Environmental factors like exposure to pollution, unsafe housing, and lack of green spaces can negatively impact health and contribute to chronic diseases that influence diagnosis and treatment. Strong social support networks improve health outcomes, while lack of support can lead to isolation and worsen health disparities. Understanding and addressing these social determinants is crucial for improving population health and reducing inequities. Investing in diagnostic equipment and training healthcare professionals is crucial to enhance capabilities in resource-limited settings. Providing basic lab facilities, diagnostic imaging equipment, and tailored training programs can significantly improve the quality of care. Point-of-care tests are invaluable in remote areas. They are portable, cost-effective, and easy to administer, enabling rapid diagnosis and treatment. Telemedicine allows specialists to remotely assess patients and interpret diagnostic images, reducing travel time and costs and making diagnosis more accessible for patients in remote locations. Global collaborations are essential for sharing knowledge, expertise, and best practices across borders. This shared learning leads to more comprehensive and effective diagnostic approaches that benefit patients worldwide. Diverse cultural perspectives from international partners contribute to a deeper understanding of disease patterns and patient populations. Leveraging this multicultural lens enhances diagnostic accuracy and improves the delivery of care. Collaborative research efforts drive the development of innovative diagnostic technologies, tools, and interventions. Global partnerships accelerate innovation and ultimately improve patient outcomes globally. Protecting patient data is critical. Regulations like HIPAA set standards for secure storage and access control. Innovative diagnostics need to be covered by payers to drive adoption. Value-based reimbursement models that reward accuracy are important. Payers are increasingly shifting towards models that incentivize quality and outcomes, rather than just volume of services. Highlighting how our solution meets these regulatory and policy requirements will be key to driving adoption. The current reimbursement models often prioritize volume over the accuracy of diagnoses, which can discourage providers from focusing on getting the right diagnosis. Shifting towards reimbursement models that reward accuracy can incentivize providers to prioritize correct diagnoses, leading to better patient outcomes. New diagnostic technologies often face challenges in getting reimbursed, which can slow down their adoption. Payers need to ensure that they cover innovative tests and procedures to foster the adoption of these emerging technologies and support diagnostic innovation. Data privacy and security are critical when it comes to sensitive medical information. Patients must have control over their health data, and robust security measures are needed to prevent breaches. Algorithmic bias is a significant concern, as AI models may reflect existing biases in the training data. This can lead to biased predictions and discriminatory outcomes, especially for marginalized groups. Ensuring access and equity is essential. These new diagnostic technologies must be accessible to all, regardless of socioeconomic status, location, or other factors. We need to address disparities and ensure the benefits are distributed equitably. Informed consent is crucial. Patients must fully understand the risks and benefits of using AI-driven diagnostics. Clear and concise information is essential for informed decision-making. Data encryption is critical to protect patient data during transmission and storage, ensuring confidentiality and preventing unauthorized access. Access to patient data must be strictly controlled, with secure authentication and role-based access policies to limit access only to authorized healthcare professionals. When sharing data for research or analysis, it must be anonymized to protect individual patient privacy. Compliance with privacy regulations like HIPAA is essential to ensure the responsible and ethical handling of sensitive patient information. Patients are key partners in the diagnostic process, providing valuable information about their symptoms and medical history. Empowering patients to actively participate is crucial for accuracy and satisfaction. Healthcare providers play a vital role in implementing new diagnostic technologies. Providers must be trained and equipped to leverage these tools for improved accuracy. Research is essential for developing and refining diagnostic tools. Collaborative efforts between researchers, clinicians, and industry are vital for innovation. Insurance companies and government agencies play a role in funding diagnostic innovation and ensuring accessibility. Reimbursement models must incentivize accuracy and value, supporting the adoption of new technologies. Patients are key partners in their own care. They provide critical information to help with accurate diagnosis and treatment. Healthcare providers play a crucial role in implementing new technologies, but they need proper training to use these tools effectively. Payers are essential for funding innovation and ensuring patients have access to high-quality, value-based care. Reimbursement models must incentivize value over volume. By aligning the interests and efforts of patients, providers, and payers, we can drive meaningful progress in healthcare. Investing in research and development is crucial for driving innovation in diagnostic technologies. We need to provide funding to support the development of new, more accurate, and accessible diagnostic tools. Clinical trials are essential to evaluate the safety and efficacy of these new diagnostic technologies and therapies. Data science and AI can help us analyze large medical datasets to optimize diagnostic models and improve accuracy and efficiency. Collaboration and partnerships between academia, industry, and healthcare providers are key to accelerating the translation of research into real-world applications. Multidisciplinary collaboration is key for broadening perspectives and improving diagnostic accuracy. Different specialties bring unique knowledge and insights that can lead to considering a wider range of possibilities. Collaboration helps identify and interpret subtle signs that individual experts may miss. Cross-referencing expertise across disciplines results in more comprehensive assessments. Healthcare is rapidly evolving, so ongoing education is critical to maintain proficiency. Regularly attending conferences, workshops, and online courses helps keep up with the latest advancements in diagnostics, treatments, and technologies. Continuous training enhances diagnostic skills and improves accuracy through practicing procedures, reviewing cases, and participating in simulations. New diseases, drug interactions, and treatment approaches constantly emerge, so professionals must adapt their knowledge and skills to provide optimal patient care. We've covered the key technologies and trends that are transforming medical diagnosis. AI, genomics, and wearable devices are all driving major advancements. But improving diagnosis is not just about the technology. It requires a collaborative ecosystem of patients, providers, researchers, and payers all working together. And this isn't a one-time fix. Continuous improvement through data analysis, feedback loops, and ongoing training will be crucial to drive further progress in this area. By harnessing these elements, transformative technologies, collaborative partnerships, and a mindset of continuous improvement, we can make significant strides in enhancing medical diagnosis for the benefit of patients everywhere.